I'm Rachel Ramsey, and I'm the president of Zaida chapter of Sigma. And this presentation is a focus on holistic, transcultural, and evidence-based practice nursing certifications. I do think that we are going to hit some other topics around certification in general as we talk about these things. So if one of these in particular isn't an area that you're interested in, I do think you'll still get something really helpful out of today's session. So now I'd like to introduce our panelists. And well, I wouldn't like to, I would like them to introduce themselves because they'll do a better job than I can. But I think we'll go in order of the pictures on the screen. So we'll start with Kristin.
Hello, everyone. I am Kristin Bassett, and I am a clinical assistant professor at IU School of Nursing. I teach the capstone and leadership courses there, and I'm excited to be here to talk to you about the EBP certification today.
Hi, I'm Dave Johnson. I'm a professor of nursing at the University of St. Francis, and I've taught mental health nursing forever. I've taught nursing leadership for a long time. But I've taught throughout our curriculum in our F&P program, our nurse anesthesia program, ASN, BSN, RN to BSN, so the whole gamut. And I've also had an advanced practice with Parkview Health since 1980. Yeah. So, and I'm still on the books. So, yeah.
And will you tell us which certification you will be focusing on today? I think you're certified in multiple areas.
Yeah, I am going to be speaking on holistic nursing, but I'm also certified as a CNS adult psych, and we'll lean into that a little bit historically. But tonight, focusing on holistic nursing.
Hi, I'm Zaida Ortiz. I'm a nursing professional development practitioner. I work for Parkview Health, and I'm so sorry about my voice, not feeling very well. So I actually help with onboarding, the Jumpstart, and also the nurse residency program. But sorry, I will be talking today about the transcultural nursing certification. I'm actually the transcultural nursing nursing chapter president here in Indiana. We only have one chapter here in Indiana.
Thank you very much. And now we're going to get right into our questions. We're going to start with the holistic nursing certification, and then the transcultural nursing certification, and then evidence-based practice certification. So Dr. Dave Johnson, can you tell us what sparked your interest in the holistic nurse certification, and also elaborate on the holistic approach and its significance in modern healthcare?
Okay, so anybody that knows me knows that I'm long-winded and I have no problem talking. So just shut me up when we need to stop because I could say my interest in holism began, gosh, probably back in 1972 or 3. When I was at St. Joe Hospital at that time. The Poor Handmaids of Jesus Christ owned the hospital and the orphanage. I was not an orphan, but I grew up with the orphans and was educated with the orphans. And the hospital was filled with immigrants. And so I had an interest in acupuncture, acupressure. We were doing yoga in the early 1970s at a hospital where nobody even knew what yoga was in our community. So I had an interest in holism going way back, and certainly within the spiritual health as well. But of all my licensures and certifications, holistic nursing was the last to be added. And so what sparked my interest in getting certified is the older I get, it's really been an interesting dilemma because people will say, well, are you certified? And so I thought, darn it, I did this with mindfulness. It's like I've been teaching mindfulness forever, and they would say, well, are you certified? And it's like, well, we started teaching this before there were any certification programs. And the same with holistic nursing. So yeah, a year ago, got certified as a holistic nurse. But what sparked that was my interest in holism and wellness, and illness prevention and health promotion, and all of the complementary practices that go along with that.
Thank you. Do you want to add anything before I invite the audience regarding the significance of that holistic approach for healthcare today?
Oh man, you could get me going, because the nursing at its roots um, is illness prevention and health promotion. And we've gone down an acute care path, which is illness, illness, illness. And by the time you have heart disease, by the time you have cancer, by the time you get sick on so many things, it's not too late to reverse anything. But the reality is, I think holistic nursing is just really cool, because it's nursing at its core. It's being present, it's listening, it's using ourselves as an instrument of peace and hope, and connecting people with the resources that they need to prevent illness, to become well. And so at its core, it's true to nursing. Not that our acute care disciplines are not true, but we really have followed the baby doc model with illness, with many of our certifications within acute care nursing. And so coming back out and looking at the big picture systemically, looking at poverty, looking at marginalized communities, looking at environments. If we go back all the way to Florence Nightingale, the notion of being able to be instruments of peace and wholeness within our world. And I think it's needed more than ever. So, yeah.
Thank you so much for sharing about that certification, and also what it means to be a holistic certified nurse. Okay, I don't see any typing or hands raised, so I think we will move on to the next certification. Oh, just as I'm saying that, Sue says, I agree that holistic nursing is needed. Is this taught in local programs?
Great question, Sue. I really appreciate your thoughts on this. There are schools that are designated holistic nursing schools, and we're in the process of becoming a designated school at University of St. Francis. It's true to our mission, our vision, our values. Locally, through Parkview Health, we had a certification process that we developed. We developed the Code Lavender nurses, helping other nurses to prevent burnout and to provide self-care. But recently, again, with budget constraints and all kinds of changes taking place within the Parkview system, the program offering through Parkview is no longer taking place. So we're seeing different certification programs pop up. I partnered with a couple of folks locally, and I'll put in the URL. I'll put a URL in for a free module that people can get connected to. University of St. Francis, we offer courses in holistic health, integrative medicine, history, or spirituality and health, and those kind of courses, and we hope to be a designated school within the next year or so.
Thanks. We have a comment from Teresa that I really love that Parkview offers a holistic nursing program. And from Jalen, I took mental health with Dr. Dave at USF 20 years ago. I am certified with my RNC MNN. I have definitely been thinking of getting my holistic certification here soon. And I'm probably going to pronounce this incorrectly, but Janika, is the certification available for licensed practical nurses?
To my knowledge, the certification it starts with the associate degree level. There's 4 levels of certification. I don't know that it goes to the LPN level. It should be, but I don't believe so. But I can check on that, and feel free to email me, and I can help you get connected. Yeah, I can help get you connected, regardless of whether you can get certification or not. Taking courses in holistic health would be helpful to any nurse's practice. And we certainly need all of the LPNs we can possibly get our hands around in, 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 in nursing. So thank you for the work that you do.
The Transcultural Nursing Certification. Can you tell us what sparked your interest in the Transcultural Nursing Certification, and describe how the certification can facilitate or impact the care of patients from varying cultural backgrounds in the context of healthcare today?
I think mine is much like Dr. Dave. I actually, when I learned about transcultural nursing, when I took the class in grad school, I literally was blown away about transcultural nursing. To know that there's an area of study that focuses on people's cultures, beliefs, and values, and then takes that information in consideration to ensure that the care that we provide to our patients and we provide as nurses is not only culturally appropriate, but also culturally competent and congruent, was mind-boggling to me. It literally lit a fire in me that I then decided to become a Transcultural Nursing Society member. And then the year that I completed my master's degree, I also applied for us to have a chapter here in Indiana, because I was looking to join a chapter as a member of Transcultural Nursing. I'm like, where's a chapter that I can go to? And there wasn't a chapter anywhere that I can go to that was close to us. And I'm like, okay, fine. Then I'm just gonna go ahead and apply to have a chapter here. And they then they was like, okay, let's go ahead and we'll go ahead and let you have a chapter there. And I'm like, okay, then we need to have a president. Okay, I became the president. So that's how that happened. And in the same year that I got my master's degree, we got the chapter, I also decided to get my certification. So that's how that went. So I just felt that it was actually needed, because I feel very strongly that in order for us to provide the best care possible for our patients, we need to first understand them, understand their culture and beliefs, to have a better understanding, because some things that they do or eat may affect their health or well-being. And so we need to know also how to show respect and display, cultural humility when taking care of them as well. I hope that answers the question.
Yes, thank you so much. I invite the audience to post in the chat or submit questions by raising your hand. But Zaida, I'm wondering about the presence and of other transcultural nurses in Indiana, and did you have a good response to starting a chapter in Indiana?
Well, Dr. Kristin Bassett, do you want to answer that question?
I didn't know about the chapter, and Zaida, thank you so much for applying for a chapter for Indiana. I am a member now of the society, a fairly new member, and I'm learning as we go through. Jonathan Lichty is also on our team, and Maria Hines. So a few familiar faces, but we do have other people. Do you know how large the society, or how many people we have in the chapter now, Zaida?
We actually have over 30 some people, but keep in mind that we have members from outside of the state as well. So we have several members that are Parkview employees, but other members like you, Kristin, that are not Parkview employees as well, and several other members outside of Fort Wayne and out of state as well.
So I think you've addressed this to some degree, but Janika asked also how your chapter has grown since its beginning. So I think I might have missed when the chapter actually started, what year, and then what's happened since it began.
So I graduated in 2018, and that's when I applied for the chapter and got my certification.
Well, you make it sound awfully easy. But I suppose when you feel really passionate about something, the work doesn't feel quite like work.
Yeah, did I not say it lit a fire in me?
Yes, you did. All right. Sue Johnson asked, what are the certification requirements? And we will get into some of this a little later, but if you want to just provide a quick overview of some of those requirements now, that'd be great.
So to understand the requirements for transcultural nursing, you can actually visit the website, which is www.tcns.org. They do have basic, and they also have the advanced certification, and they can actually explain what are the requirements for those certifications.
We will get into the EBP nursing certification. Does that sound okay, Kristin?
Yes, I am ready.
So we're going to ask you the same first question. What sparked your interest in the evidence-based practice certification? And can you explain how it prepares a nurse to engage in or lead the integration of research findings into their decision-making and or practice?
So my initial response to the first question is going to be completely different from the last two. Because for me, I don't recall hardly any, if any, real discussion about EBP in my undergraduate studies. And I don't remember it really being a topic of discussion back then. So I know recently we've kind of integrated more EBP into our curriculums, and it's touched on here and there. And I think recently in the IU program, I've noticed that it's hit much harder, even than previously at other universities I've taught at. But for me, it kind of fell into my lap, so to speak. I graduated in 2021, May of 2021, with my doctorate, my DNP, and it focused on a huge part of my studies, focused on implementing an evidence-based practice project. And in doing so, I went through all the steps of the EBP process, understood the process much better, and then took that forward and presented at the Helen Fold Conference in Columbus, Ohio. While I was there, they had a table set up with the EBP director, Cindy Beckett, there, and she was promoting the EBP certification. I found out that the EBP certification kind of came around in 2022, I think was the first EBP certification that was given out. So it's fairly new. So again, I didn't know about it. I didn't know that it existed before then. And that was in May of 2023. So I was very excited about it. And it really sparked my interest when she said that I had done most of the legwork already for the certification, because it does require, it's a 3-step process where you have to do some sort of coursework, which my DNP studies qualified for that. And then a knowledge exam, and then the creation of a portfolio. That was a little more in-depth and detailed. But I had a lot of that work already written. So she said for my situation, it would be very, very easy for me to move forward and get that certification fairly quickly. So that was really what sparked my interest was to learn a little bit more about EBP, and it really kind of helped me to I don't want to say validate, but it kind of confirmed that I understood EBP well, and it was something that I wanted to make sure I did because of the courses that I teach.
So do you feel like that certification did help you feel more prepared to do the kind of work that you do with the students that you teach in those evidence-based practice courses?
Yes, and I think the certification itself, it kind of, I think that because it's a knowledge-based test, it kind of helps you it actually, it helped me to know for sure that I knew the information that I thought I did. When I first started looking at the study materials and that sort of thing, I thought, do I know this as well as I think I do? You know, so it really kind of reinforced all of that for me as I'm looking through it. And I thought, yes, I did learn all of this in school when I was, you know, in my studies and going through my evidence-based practice project. But the certification, I felt, gave me more information because it really talked about best practices right now, most current things, and added a little bit more information from what I had even in school. So I felt like it helped to prepare me a little bit better. I walked through my project one more time through that EBP lens of best practice, and I think that it gave me the knowledge and the tools that I can use in the classroom to help students better understand evidence-based practice as well.
Thank you so much. I like that word that you used about like feeling validated in your knowledge and like the expert that really can share with the learners. So I welcome others to post your questions or unmute and ask your questions to Kristin about the EBP nursing certification at this time. Maybe as some are thinking, I will add that I have thought about this one. When I saw what the requirements were, I felt a little intimidated, and I thought, well, I'll come back to this later and I'll dig in a little bit deeper. So maybe I just need to have a conversation with my pal, Kristin, and talk through some of those expectations for the certification.
I agree. I was very intimidated as I was reading kind of through the requirements until she let me know that I've already done most of it. Don't get overwhelmed right now as I'm sitting at the table reading through everything. I think she probably saw my eyes get big and I thought, oh my gosh, I don't know if I can do this or not. And she said, yes, you can do it. So if that's something you're interested in, I'd be happy to sit down with you and go through it.
Great. Thank you. So you all might come up with more questions after you hear the next question for our panelists. And this is a question to all three. So it's up to you how you want to start. If you feel compelled to say something from the get-go, just go ahead and kick it off for us. But the question is, in addition to the things that you have already shared, what do you see as the most significant benefits of being certified in your specialty? And if possible, give us a specific example of how your certification has directly benefited your practice.
I feel like the certification, as I said before, really kind of validated that I knew the information and that I understood EBP well, which I feel has benefited me in the classroom, because as I said before, I think that in my undergrad studies and kind of throughout nursing, EBP it's not a new concept. We know about it. We realize it's out there, but it really hasn't been highlighted or focused on as much as it should be. And I think that the more information and knowledge we can get out there to nurses, they can be more involved in those projects, have a better understanding of it, and it won't be as scary or intimidating when you join an EBP committee or want to engage and help out on those EBP projects that are out there in the community or in the hospitals or wherever. And there's obviously value in it. You know, the more decisions that we can make based on evidence is only going to improve our healthcare and our patient outcomes. And we care about our patients, our friends, our family, and it's important.
Thank you. Dave, what can you add to that?
Yeah, this is going to sound so self-serving, but I think the certification has just fortified some relationships with other certified holistic health nurses. You know, forever as an advanced practice mental health nurse in psych, I practice with a team of other licensed individuals, psychiatrists, psychologists, social workers, marriage and family therapy folks. And it was very, very diverse. And I learned a lot about doing therapy and medications. Oh my gosh, throughout the years, all kinds of, and the anxiolytics and the antidepressants would go on to be the most highly prescribed drugs in America. But at its core, this notion of holism and the roots that I had early in my career, and I really missed being with nurses. Um, and even though I love my interdisciplinary colleagues, at the core, I'm a nurse. And so the certification within nursing was good for me. Oftentimes people will say, you're a nurse? There are events, certification events where certified other nurses got together for all kinds of things, and I wasn't invited. I wasn't at the table. I was forgotten. And then within mental health, my gosh, we were some of the first certified nurses to have our practices and prescribe medications and do group therapy and fill the gaps within the healthcare delivery system within mental health and all sorts of wonderful things. And yet, sometimes when you work in an interdisciplinary team, people forget that you're a nurse at the core. And so holistic nursing brought me back to nursing, and I'm seen as a nurse again. So yeah, self-serving.
Zaida, would you like to add anything to the benefits that you've experienced with certification?
Yeah, I think for me, the most significant benefits of being certified in my specialty, I would say learning so much about my patients and what's most important to them, and being able to draw up a care plan that's very specific to them. I think that's very helpful.
I like that practical connection between your certification and the things that you do in your practice every day and how it enhances that. So I have a couple of questions regarding the certification process that we may or may not cover in the upcoming questions. So I'd like to ask those now. One is, what's the length of the certification period? So I don't hold any of these certifications, but I am a certified nurse educator, and I know that that is a 5-year time frame. So I think the question is about how long does a certification term last? And then also, what does recertification look like for each of these certifications? And you may not have the answer right now, and that's okay. But it looks like Zaida's unmuted, so I'll give you this.
My certification lasts 5 years. And to recertify my basic, because I actually hold basic, you just have to make sure that you just keep up with your hours. So you attend educational, learning meetings and stuff like that in regards to anything that is diversity, equity, anything like that in regards to your specialty. And you just have to submit proof that you did that, basically. Does that make sense? So it depends if you're basic, if you hold basic, or if you have advanced. So you just have to look at which one you have and just see what is specific to you in regards to recertification guidelines.
I can answer about the EBP. For this renewal process, or the certification time is 3 years. So every 3 years you have to renew, and the renewal process is is a little bit different depending on your role. So as an educator, you have to provide proof that you are helping students with EBP projects, teaching EBP, engaging in continuing education surrounding EBP, or those sorts of things. For practice, and honestly, as an educator, I could participate in EBP projects as well. If I had some extra time to do that or be involved in those, that would be fantastic. But in the practice setting, those nurses who are certified renew by displaying and discussing what kind of work they've been doing to just demonstrate and show that they've been using their skills, their knowledge, participating on EBP committees, and they're involved in different projects that are happening.
Dave, do you happen to know these answers to the holistic
You
one?
know, it's so interesting because I never thought I would sit for another certification exam. You know, I'm still trying to figure out what I want to do when I grow up. And so when I landed on sitting for the certification a year ago, so I did some digging, and it's a 5-year research. But you know, I never intended to get certified again to begin with, and so it was the farthest thing from my mind that I would recertify. But I think I will. I think I will because it's true. You know, at the core, at the end of the day, I can hold certifications in lots of different things, but I think this one is the nearest and dearest to my heart.
And my experience with recertification, if anybody's interested, was compiling either a portfolio with evidence of the things that you had been doing, similar to what Kristin described, or you could pay to retake the exam. So that might be an option with some of these, but it's probably better to demonstrate over time the things that you've been doing instead of paying that fee and testing your knowledge again. Laura says, I'm glad to hear I'm not the only one who isn't sure what they want to do when they grow up. That's not the first time that I've heard Dr. Dave say that, and I've said it myself, so I still am deciding as well. Okay, we have another question for all of you to answer, no specific order, and this is more about getting certified, so along the same lines of the things we've been talking about. Can you identify any common misconceptions about nursing certification, either in your area or otherwise, and provide some clarification that might help us decide whether it's right for us?
I don't know that there's any misconceptions with holistic nursing in terms of who we are and what it means. I do think that there it can be confusing because there's 4 levels of certification, and plus there's a nurse coaching certification, and not all very few nursing schools. I think there's only like maybe 15 nursing schools in the United States are designated schools as holistic nurse schools at this time. But I think that will expand and all over the place. I think it will grow. But for me, I don't think there's any misconception because it's so true to who and what we are as nurses. What people can do with it, I think we drill down on our specialties within holistic. I know for me, my work with mass casualty, horrific crime, brutal injury, and as we discovered those complementary practices that helped, in addition to medication, we moved people's eyes with EMDR. We learned, I mean, the drill down on mindfulness at its core because of dissociative processes that were taking place in people that were traumatized, people coming back from Vietnam. You know, we learned a lot about trauma, and then we continued to learn. And so for me, I wanted to bump up to other certified people that would drill down on Reiki, or would drill down on massage, or drill down on journaling processes, or the whole notion, you know, of mindfulness was just one piece of the funnel with helping people to gain equanimity. And so you become certified as a holistic nurse, but that's huge. But then continuing to drill down on specialties within the certification. And that's where the real fruits of being connected with other with other certified nurses that have taken on things like aromatherapy or have taken down, yoga therapy. So many of my colleagues that are so helpful with helping people come back to balance through yoga, or tai chi, or qigong, those complementary practices. So, yeah, I'm rambling.
No. Before we move on, Terry Walker asked, a holistic nursing certification is not through ANCC, correct?
It's through the American Holistic Nurses Credentialing Council. And I will put that website in as for us as well. So it's not the same. No, it's not ANCC. It's through the American Holistic Nurses Credentialing Council.
Thank you for the clarification. She also said that she encourages anyone to take a review course. Even if you don't take the certification test, you will gain knowledge for sure. So what are you going to tack on for us, Kristin?
I was just going to add on, I don't know of any misconceptions about the EBP certification specifically, and I think it's fairly new. So, I don't know that it's been around long enough for people to form any misconceptions yet. But I do think there are misconceptions about certification in general and nursing certifications, such as some things that I've heard. Newer nurses shouldn't get certified right away, or they can't get certified right away because they're new and they're learning still, or that it's too hard or it's too complicated. And I think when it's something new and you're learning about how to go through that process, yes, it does look challenging. It does look complicated. I think, Rachel, you just shared yourself that it looked like a lot and it looked a little overwhelming. But I think if anybody sits down and kind of goes through it, there are other nurses out there that are so supportive and can help you along the way. I had Cindy Beckett, the program director, was amazing and walked me through every single step because I didn't have peers or any friends around who went through the process yet. So I think that is just a common one overall, that it's too much, or it takes too much time, or the recertification process is too much. And I know they're all a little bit different, but I do think it's manageable. I think that it's something that any nurse could do, even if you're a brand new nurse and you have something that you're passionate about, it's worth it.
I think that's an interesting point that I've wondered about myself. When do you start thinking about certification? And is it appropriate to start thinking about what kind of certification you might pursue when you are in nursing school, or when you're a new nurse, or if you're thinking about going back to school or changing your role? Would you have any well, I'm going to ask an advice question later, but maybe that's okay to ask it here. Do you have advice on when to start thinking about certification, depending on where you are in your career?
I don't think it's ever too early to start thinking about it. I think that nursing students can be overwhelmed if they start thinking about certification in nursing school, because NCLEX is huge. It's a big deal, and it's hard, and it's very overwhelming and stressful. So adding on an additional thing to start thinking about before graduation might seem like a lot. But I don't think, and I would love to hear from other people as well on their opinion, but I don't think it's too early, to start thinking about it, or to even start pursuing it as soon as you graduate, because at the end of the day, it's giving you additional information about something that you're passionate about or something that you're very interested in. So I think it's great.
I really appreciate what you said, Kristin. I too am in the belief system that early is good. I think one of the reasons I want to help St. Francis become a certifying school is that our students immediately following NCLEX could sit for the certification exam for holistic nursing. Otherwise, they've got a 2-year period of practice before they can sit and get the CEUs required. But from my perspective, as soon as one becomes certified, you take on an identity of this is part of who I am, and I'm in a community of like-minded or like-spirited individuals and excited about that journey. And of course, holism goes across the whole landscape of nursing, including that acute care. But in all of the specialty areas and all of the lifespan, it fits. So it's an appropriate certification for every nurse, I believe.
Thank you. Zaida, I haven't seen you unmute, but I welcome you to chime in to anything that's been added so far.
It's okay. I was having my coughing fits over here. Sorry.
That's all right.
I agree with what Dr. Dave was saying about having the exam after having the holistic class, because that is exactly what I did. I had my transcultural nursing class, and in that same year, I ended up taking my certification exam. That's how I did it, because I graduated, I took my exam the same year. I did everything. And so, because it was still fresh in my head. And I think that will be helpful for the students as well. So I do agree in doing that. In regards to misconceptions, in my head, I'm thinking a lot of people just are not, I guess, I'm not sure if misconception is the right word, maybe not understanding what is magnet approved certification. Because that is one of the things that some, I guess, employment are looking for, like, magnet approved certifications. So maybe looking at what are magnet approved certifications. Like, for instance, a lot of people didn't know anything about transcultural nursing certification was a magnet approved certification until they pulled it up. So that is something maybe they need to be aware of, is like maybe seeking information. What are magnet approved certifications? That's just my little 2 cents there.
I would never have considered that. So I think that's really helpful advice. There are a couple of comments here. One from Nathan, who says that I feel that a certification will help a new nurse grow and adapt to his or her career. So I think any one of these certifications we're talking about today would certainly do that, regardless of what your interests are. And then I'm not sure, it looks like a username here, so I'm going to say Aubrey. Aubrey says, I agree. I feel like it would help nurses become more empathetic and well-rounded. And Mariah adds, as a new grad, I appreciate those thoughts about the timing of when to start thinking about getting certified. During school, I never thought about certifications because it was stressful, but these are great insights. So thank you.
I wanted to piggyback a little bit on what Nathan said about helping a new nurse grow. Dave mentioned how he feels more connected and, taking him back to being a nurse. And I think that as a new nurse coming into nursing, into healthcare, they would feel some of those same things, feeling connected, having a community of other certified nurses, and just feeling that camaraderie. I know there are conferences for certified nurses and so forth, and being able to join those activities, those events, and being connected to other nurses and sharing ideas and sharing, thoughts. And I think it just really helps to solidify that connectivity between new nurses. I think it would be great.
Great point, Kristin. Thank you. So I'll keep an eye on the chat. You all continue to add in it as you see fit. We're going to ask our next question. This also gets at the journey to certification. Could you share a challenging experience you faced? And Kristin, you've talked about this a little bit already, related to your certification journey and how you overcame it. And I think that you can broaden this to any certification journeys that you've taken over time, not necessarily just those that we're talking about today.
I think some of the biggest challenges are really knowing what study resources are going to help you. What does it all mean when you're reading through the process online? And to have someone that you can reach out to kind of help guide you through that process, especially if it's somebody who already has the certification. They would be a great mentor to help kind of walk you through that process and make it look not so scary or intimidating and overwhelming. Because I think anytime you sit down, regardless of what the certification is, it looks like a long, drawn out process, and it does look very, very intimidating. So I think hearing from someone who has it, what that looked like and just kind of walking you through it is so helpful.
Laura adds a guide would be awesome. And perhaps there are some of those more detailed guides. I think I've seen some certifications that are more vague in the expectations, but it sounds like Kristin had an experience where they really were able to walk her through. So there's a literal guide and a figurative guide in that process. But Zaida, I saw you unmuting to answer this question. Do you want to add something? I'm going to assume that Zaida is having a coughing fit.
I was sorry.
Oh, that's okay. So do you
Yes.
want to pass it off to Dave, or do you want to try to add now?
No, I'm good right now. Thanks.
Okay.
Well, since the only thing is because there was no chapter here. Remember, I started the chapter here. So I actually had to reach out to the society. We did not have a prep course. So there was no prep course. I'm like, oh, good Lord, how am I going to prepare for this exam? So what they actually have on the website, they have a guide. They actually have a guide on the website, which you can download. And the guide serves as a map, actually. It breaks down the number, like gives you exact, like 15% is the content on this, like 20% is the content of this. So it gives you the topics that is going to cover on the exam. So it gives you like a breakdown of what is going to be covered on the exam, and that is exactly what you need to be studying for. So they also tell you like which books to study. So she basically told me there are 2 books that you may want to purchase if you don't already have them when you went to school. But these are the 2 books that you really need to have to study from. And that's what I used for my exam, and which was helpful. So, but, like I said, all you have to do is just basically visit the society website, download the guide, the exam guide. They do have, like I said, for the basic exam, and they also have for the advanced exam. It will be cheaper if you became a member. I'm just going to tell you right now. But that's all you basically need to do is just become a member. It will be cheaper. Download the guide and go from there.
I think you bring up an important point about the cost, because there are costs associated with these certifications.
Yes.
And if you all are aware of avenues that nurses can use to support those costs, then please do add those to the things that you comment about, but I don't have to spend a lot of time on that question.
And I did forget to mention, when you recertify, you also have to pay a fee, but if you're a member, again, it's going to be discounted.
I think misconceptions occur throughout history. And so if you're in the discipline long enough, confusion will happen. And so I think, I go back to starting nursing school in 1975. And the world has shifted, and our knowledge and our expertise has shifted. it was the 90s that was considered the decade of the brain. And so when you go back in history and you think about early certifications, for example, the Psych CNS, which was the precursor to the Psych NP. And the Psych NPs don't even know that history. It's easily forgotten. If there's anything I've learned is that we forget our history, and it's helpful to go back to our roots, our early beginnings, our early theorists who laid the foundation for the work that we do today. So I really appreciate the words, of Kristin with EBP. Oh my gosh, all of the misconceptions about some of the holistic practices. And so I could say to my colleagues, go back. What's the evidence show about mindfulness and trauma in EMDR? I mean, I thought EMDR was wacky tobacco, moving people's eyes with a wand while I were talking about their deepest emotional things that took place in their life. I mean, it was, and I was wrong. And I was wrong. EMDR would become a mainstay with individuals that were traumatized. And mindfulness, oh my gosh, Parkview wouldn't allow me to use the word mindfulness when we first started to teach it. I had to call it the power of pause, because mindfulness was so connected with Buddhism, and we're a Judeo-Christian world. You're not gonna have people close their eyes and meditate, are you? I mean, so yeah, misconceptions all over the place, but coming in with EBP and figuring out what the science says and what it is, and using that exact language as a nurse scientist to be able to build the groundswell of what we're doing in our practices. So, I mean, there's an intersection to all of this. The holistic piece has been at the get-go from all the way back to Florence. But we need our other certifications as well. They're interconnected, they're overlapping, the work that Zaida's doing. Yes. And so all I can say is, our NCLEX exam, wonderful. But that's the starting point. That's the baseline that we all need. And then figuring out how to get certified in the areas that we're passionate about.
Thank you very much. So I'm going to read a comment from Terry Walker, and I would encourage all of you to explore these options in your organizations. But Terry says that Parkview pays for several certification tests the first time, and she believes, so there's a little caveat there, it might not be true for all of them, but they also have pre-review courses for 30 different certifications. So explore those options in your organizations. But also, something Zaida said earlier made me think, I have some study materials that I've used over time that have relevance to certifications. And I bet there are lots of nurses who have materials like that, and public libraries. And there are resources available for study that maybe you don't need to purchase, that wouldn't be an added cost. And if you can't find them, reach out to your colleagues and managers and even former nursing instructors or current nursing instructors to see what's available that you could tap into. And Dave has provided the link to the free module that he mentioned earlier from Sarah Weaver on the FNP Holistic Health, Nursing, and Functional Medicine module. That's great. Thank you so much. So if you want to access that, go ahead and click the link in the chat. I can follow up at the end of this with everybody by email and share some of the things that we talked about as well. So we've reached our final question. We are ahead of schedule, and there'll be lots of time for the audience to ask more questions at the end if they'd like. But my question for the panelists is, what advice would you give to nurses and nursing students who are considering certification in your area but aren't sure where to start?
Before I answer the question, Rachel, I just wanted to make a comment on what you just said as well. A lot of our everybody is very socially connected these days as well. Social media is huge. And I think that nurses love to support nurses. We love to help each other out and bring each other up and help each other along our journeys in any way we can. So I think reaching out to other nurses or putting out there on social media or, networking to say, is there anyone who has any study materials? I think a lot of people would be happy to share what they've done, what they've used, and pass that book along. If it's because eventually by the time they go to recertify, there might be another book, or maybe they get that book back. But either way, I think sharing study materials and helping each other out is a great way to kind of cut costs, and again, you're asking for assistance, that mentorship. To answer the question about nurses that are unsure where to start, I think you would just, again, reach out, look for someone who has that certification, ask around, network a bit, but also looking at those websites or those materials that wherever. I think Dave has some websites to share, and I have a website for EBP as well. It always has a lot of information in there. Again, it might look overwhelming, but it's a good place to start. And sometimes when you are on those websites, it does have a contact person that you can reach out to. My person, like I said, was fantastic. She was willing to Zoom with me, take my phone calls, answer my emails, all of the above. So I think that finding a contact that you can reach out to with questions, whether that be a mentor or someone on the website that is involved in that process, is a great way to just get started. Or even just thinking about, what are you passionate about, so that you know what avenue to go down. Yeah, can't think of anything else.
I keep muting you because I spotlight you and then you're on top. So I apologize for that. There's a couple comments in the chat. Terry Walker recommends study groups, which I've benefited from significantly. And then Dave recommends Sigma, or Zaida Chapter is what we're part of. And that's a great way to network and make connections with other certified nurses for sure. Dave, what were you going to add?
I was just going to, replug Sigma, because I do think that we need these big organizations. And throughout the world, Sigma helps to represent nurses. And so if there was only one place I would get connected, it would really be Sigma. And then I kind of, and you didn't pay me to say that, Rachel, but I think, I think we need places outside of our organizations. I believe in my mission and vision and values at St. Francis, and I love the work that I've been able to do as a ClinSpec at Parkview Health. But I need these outside organizations to anchor me as well and to network. One of the things that I'm not doing well with in holistic nursing is I've not been able to identify a master's prepared holistic nurse. I took the baccalaureate level because I wanted to see what students were going to be able to take, but I really need a master's prepared person, and they're few and far in between, to have an advanced holistic nurse practice. Many of our FNPs get certified within functional medicine. And so we don't see nurses coming back to holistic nursing. They get that ASN, BSN certification, and they don't go back for that master's degree. And so I need of a master's prepared person. I don't know if I'm going to take the exam or not. Time will tell.
Zaida, do you want to add any advice before we open up for more questions?
I would have to agree with what both Dr. Dave and Dr. Kristin, I have to get used to saying that too, said. I did help with study groups because like I said, I started the chapter. So I was the first one certified here as a transcultural nurse. And I had another member that also got certified. But I'm trying to get more people certified. The only problem is that, again, we do not have prep courses here. So sometimes trying to get people to come into study groups is a little difficult, especially with, people's work schedules. So that's another thing. But it is helpful networking. I will say that. I will agree. The one thing that I will say for Parkview has nurse builders. They have the certification center. So they do have a lot of certifications that they do provide. They have courses that they do provide for free for our employees. So they can actually take those review courses. And that is helpful for our nurses. So I will say that. But transcultural nursing review course is not there, which I'm really sad. So for that, they will actually need to go to the Transcultural Nursing Society website. And then they will need to download the guide. I will say that I have reached out to the director, and they are in preparation in doing a review class. They're not done quite yet, but they're in preparation of finishing, and this is what they're telling me. So hopefully they'll be done soon.
Great, thank you. So I want to come back to, for a moment, something that Kristin brought up about kind of identifying what your passion is and how you might align your passion with certifications. And I don't know that any of us can answer this question, but aside from connecting with an organization like Sigma, is there a place where we can learn more about what certification options are available and how to decide which one is a good fit for me and the passions that I have?
There's not a clearinghouse, I don't believe, for certifications. There's so many options for us today. But I would go back, Rachel, to this notion of Sigma kind of being a greater, a bigger umbrella where nurses can figure out about these certifications. Within holistic nursing, I put down, one of the textbooks that I use in my course, but I know in preparation, it doesn't show on the screen very well, but it's Josie and Keegan's Holistic Nursing. It's a thick book with lots of integrative health complementary practices, and it's the Bible, so to speak, in terms of the work that we do within holism. So anyone considering a certification or an interest in certification within holistic nursing should consider picking up that textbook. Yeah. But the networking, I'm motivated by you, Zaida, to think about getting a local chapter with the holistic nursing. Not that I'm looking for things to do, but I think it's needed. And I appreciate, Rachel, that you and your Zainu colleagues have put together this seminar, because at its very core, I think this idea of getting the word out about various certifications is needed. So thank you.
Well, thank you for being here and contributing, because I couldn't answer the questions that I've asked you today. So I need you there. I do want to point out also in the chat, in addition to the book that you've added, Kristin Bernecki said that she has 3 nursing certifications and that she much prefers taking a review course than studying on her own. So thanks for the recommendation, Zaida, to get involved with study groups. And another thing I wanted to come back to is something you mentioned early on, Dave, about certification related classes or coursework within a nursing program. Are there other kinds of classes that are available that might be a nice introduction to what a certification can offer, or different types of certifications that are available that could be a one-off that I might enroll in a course at USF to learn more about the holistic certification or holistic nursing, for example?
We're not there at USF just yet, but we will be. And for now, as budgets get tight, like at Parkview, we've kind of pulled back from helping our nurses go through a certification process in holistic nursing. I can't speak for the other certification processes, but I do know that if folks contact the American Holistic Nurses Association, um, and I'm trying technology wise to put that URL, but I have to search for it while I do it. And so I'm scared of losing my screen. Not the most techno wizard here. But I would go to our headquarters, and they offer all kinds of courses. And so I know this summer I'm going to take something on appreciative inquiry. David Cooper Writer's work, I just think is a really, really wonderful framework for working with all kinds of systems that's holistically inclined. And so I think when you connect with American Holistic Nurses Association, you'll see those kind of courses that are being offered, and they're one-offs that help you to drill down in terms of what your interests are.
Great, thank you. Unless Kristin or Zaida wanted to add to that, I wanted to bring up another thought. I hope I'm not compromising too much of our question and answer time here. But what I'm hearing is perhaps that if you're considering certification, networking is a good next step to potentially identify others who are interested in certification or have certifications. And then maybe that becomes a study group that you can prepare for that certification with. But I think anyone who's in your sphere of practice might be able to help you just brainstorm what kind of certifications might be of interest to you. And again, that comes down to networking and just knowing what's available, what resources or options are available. Because there are a lot of certifications that I didn't know exist. The holistic one being one of those. And then, of course, Kristin mentioned that her EBP certification really just started a couple years ago. So